Lejano, this is One News Now. House lawmakers continue their probe into corruption allegations hounding PhilHealth. However, 3 key PhilHealth officials left the House inquiry due to medical reasons. To give us more updates, we have Ria Fernandez. She's reporting live from Quezon City. Ria, what is the latest?
Charles, a lawmaker challenged PhilHealth officials to sign bank secrecy waivers to pave the way for anti-money laundering council check. But PhilHealth President and CEO Ricardo Morales had to leave the Zoom hearing before he could respond to the challenge, saying he was not feeling well. Deputy Speaker Villafuerte dared PhilHealth officials to disclose their bank transactions to the AMLAC as the lower house continued to grill the embattled agency. Challenge accepted for officials present in the hearing, but Morales, as well as EVP Arnel de Jesus and Legal Chief Rodolfo del Rosario Jr. eventually left the virtual hearing due to medical reasons. Meanwhile, House Public Accounts Chairperson and Nakalusugan Representative Mike Defensor said the so-called PhilHealth mafia thrived due to the agency's all-case rate policy. Under the scheme, PhilHealth pays hospitals based on the rate of the package for a certain disease, even if the services availed by a patient is of a lower amount. Defensor noted that the Commission on Audit has time and again flagged the said policy since its implementation in 2013. Citing COA, the lawmaker added that PhilHealth also paid several hospitals despite the absence of claims. With this, Defensor is convinced that a collusion between hospitals and PhilHealth exists. He is also bent on filing plunder charges against PhilHealth officials down to those at the helm of its regional offices. Villafuerte, meanwhile, also questioned PhilHealth's reimbursements even to non-accredited hospitals, to which the agency's senior vice president Israel Pargas responded that they only do this if the hospital is licensed, as well as when faced with emergencies. As for the all-case rate, the PhilHealth official insisted that they have already responded to COA's findings and that the rates were based on hospital billings and DOH data. Charles, the House panels will also be inviting other members of the PhilHealth Board, including its chairman, Health Secretary Francisco Duque III, on its next hearing, probably at 1 p.m. tomorrow. Charles?
Thank you, Ria Fernandez. Here are other stories we are keeping our eyes on. An additional 960 traditional jeepneys will be allowed to ply 15 routes once Metro Manila reverts to GCQ. The LTFRB says the PUJs may resume operations without special permits. The drivers are still required to present their downloaded QR codes from LTFRB's website. The Health Department assures the public that Russia's COVID-19 vaccine will undergo regulatory processes once it reaches the Philippines. The DOH adds that the Food and Drug Administration, as well as the country's vaccine panel, will look into all safety concerns raised by stakeholders. And the Labor Department reports that over 136,000 OFWs have been sent home to their provinces since the onset of the pandemic. The DOLE says the latest batch of more than 2,600 overseas workers who tested negative for COVID-19 were brought back to their homes on August 11. For more updates, follow News 5, the Philippine Star, and Business World online. Visit our website, onenews.ph, for more in-depth analysis. And you can also catch One News on the Signal Play app. Register for a free account at www.signalplay.com and stream One News live anytime, anywhere. We'll throw you back to the House Committee hearing on the anomalies in PhilHealth. I'm Charles Lejano. We are One News.
Congress not only